complex trauma where there's also a history of childhood abuse. Oftentimes these patients have comorbid psychiatric conditions like depression, anxiety, panic attacks, or substance use disorders, and depending on the trial, they've kind of allowed some of these conditions in. And you know, these trials are looking at PTSD at the endpoint, but I think it's also very cool and interesting to see things like comorbid depression approving, because kind of the narrative out there with MDMA is that it depletes serotonin, and you've maybe heard of the ecstasy blues, is for a period of 2 to 5 days after MDMA use you're kind of lower, and oh, maybe MDMA has kind of a depressant type of effect on the back end of the experience. And while serotonin depletion with MDMA is a real thing, it's very reassuring to see some of the things like comorbid depression actually improve along with the PTSD. And again, as Cherie mentioned, you know, in these kind of, when you summarize and put all these phase 2 results together, the kind of remission rates for PTSD seem to be somewhere between 60 and 70% versus maybe 20-something% with placebo. So really incredibly meaningful results, and psychiatry's never seen anything like this. They've never seen something where you take a drug 1, 2, 3 times and a year later you're still better. That just doesn't really exist in the current paradigm. So incredible. There's a few other indications of MDMA out there that have some small studies for them. Social anxiety in autistic adults, so I think this one's really interesting. Autism, kind of typically manifesting as a lot of interpersonal or social difficulties picking up on social cues, and it seems that MDMA kind of reteaches them how to socialize and kind of be more sensitive to some of the social cues that most of us are in tune with. MDMA has also been studied for anxiety with a life-threatening illness, and then they have a study that's ongoing in the United Kingdom right now for MDMA-assisted psychotherapy with alcohol use disorder. Ayahuasca. So this one's kind of interesting in that, well, I don't know, there's so many reasons that ayahuasca is interesting. But I think that the interesting part from a pharmacologic perspective is that when you take DMT by mouth alone, nothing will happen. You have this enzyme in your stomach and liver called monoamine oxidase that just chews it up, and you won't get a psychedelic effect from it. So when you hear about psychedelic experiences with just DMT, they're usually talking about a smoked route of administration. You can snort it or use it by injection, but that is not a therapeutics lecture, at least yet. So ayahuasca itself does not refer to a DMT-containing plant. It refers to a monoamine oxidase inhibiting plant. So the ayahuasca vine basically provides a protection for DMT to be able to enter systemic circulation, reach your brain, and produce psychedelic effects. In ayahuasca culture, the vine is also purported to be extremely healing. So oftentimes when you hear about ayahuasca, it's kind of a DMT-centric type of conversation, but monoamine oxidase inhibitors were the first antidepressants to market, and there's certainly a lot of other things in the ayahuasca brew and vine that we probably haven't characterized well enough yet. So I don't want you to walk away from this talk thinking that, you know, ayahuasca healing is purely about DMT, because this vine is absolutely central to DMT even working, and also has a very long historic lineage of being known as a healing plant. Monoamine oxidase inhibitors, though, have the potential for severe drug interactions. So you cannot really be on serotonergic drugs like SSRIs or SNRIs while taking ayahuasca. You have to wash them out beforehand. Ayahuasca is also not compatible with some other kind of stimulant-based psychedelics, things like MDMA. You can end up with very severe physical toxicity. So when you're kind of thinking about ayahuasca use, you know, kind of drug interaction and what the person is taking at baseline should kind of always be in the back of your mind. I'm going backwards.